Well, greetings again. This is Dr. Bill Wyatt, and I'm with the American Orthodontic Society. And we're trying to get across to people to allow nature to finish cases up. It can mold and make the mouth as it does as it grows up, rather than going in and doing surgery, cutting it up in pieces and putting it in and hoping it grows back. Just guide it out here and let nature take over. And this is the point I'm trying to get. And so we've come up with a system of doing orthodontics that we can move the teeth any direction that you want to, really. In here, we can go up and down with the teeth. We can expand them in or out. We can round it out. We can rotate anything in the arch, and we can do all this and work on the temporomandibular joint and keep it and let it grow and go like it normally would too. So let's get in here on this case. I'm going to run through a lot of just the regular orthodontics real fast. And if you want to go, you can look at other videos probably of the same thing. So let's get started here. Now this is a young lady that came in with a mouth looking like this. Now how in the devil could we surgically correct that? It would be a miracle. However, we can let nature come in and do this. Now I'll widen this arch more than any one I think I ever did widen out. And look at the shape it's in. And there was a defect in this arch, right in this area right here. I didn't even know it was there, and we separated the palate here and in this case, and this defect didn't get any bigger in there. So are you going to let this person grow up like this? Or if you had to do surgery and move the teeth where you wanted them, it would be a tremendous surgical procedure. On the bottom arch now, it's a little wider than the upper arch, so we again, you got mouth breathers. The tongue didn't come up and widen this out. If you can catch the mouth breather when they're young and fix it up whatever it is, whether it's the adenoids, the tonsils, the turbinates, the allergies, everything you can do in here to get the person functioning correctly, then that makes the teeth come in correctly. All right, the tongue guides them in. All right, down here we're missing. They got something down in here. We've got to hold this gap open and let that permanent tooth come up through there. Now these are videos. See this tooth leaning down here? We're holding this out of the way and allow that tooth to come on through that gap. Now I don't see a wisdom tooth, but here is the 6-year molar, the second molar, and the wisdom tooth would be back here. But the child is pretty young at this point. Same thing over here. We're letting this tooth come up in that space. I see no wisdom teeth forming in this particular case. So we're holding that space open in there. We're going to level this arch out in this area. And we took the old Pediatric. We'll have to come in and cut that thing off like that, put it together. All right, we put a palatal separator in, and we separated this palate, I think, more than any palate I ever did separate in all these years. This was 1976 when we were doing this. I pulled it out. I don't ever use this wire anymore. We don't need that, really. We can get on the outside and keep it out like that. But back then, we put it in the palate. And when I got through with this, I looked at it as a defect right in here, where it's nothing but tissue, no bone in it at all. So we lined the teeth up, put the brackets on, went from there. Now we're working on lining it up. And I came in with one palatal separator, pushed it out, and now I put another one in and widened it out even further. And now we've got it out. We've got these teeth way out like this, and you saw where we started those. In other words, we move it out here and let nature fill the gap, fill the bone in the area that we're doing. We just kind of pushed it out there and it'll grow. And you can widen anybody's arch as long as they're living. I don't care if it's somebody that's 85 years old. I've not started anybody in their 90s, but I've taken people that old and widened their arch. Now where you widen it with the Big Daddy arch, it goes out like this. And then with the palatal separator, it'll go kind of this way, but then when you close them, it brings the front of it back in to some extent. So we widen this arch that much, so you can bring any arch as big as you want to fill the gap in the person's mouth. How they marry. People marry a large person and a small person, and sometimes the teeth get the big person's tooth in the small person's skeletal structure, and it just doesn't fit. And so it's idiotic to say you need to put teeth in there because God gave them to them. God didn't mix them up that much like that. And so when they're mixed and the big person's teeth go into the small person's facial structure, you've got to reduce the teeth, or else the face is going to look like that when you get through with it. All right, here we had some little undersized lateral teeth. We'll have to shape them up. I use this bar, but I don't ever use that anymore. This palate was operated on, I think, when this child was a baby, and there's a defect right in here that is no bone in that area. But when we separated it, it didn't get any bigger. So we started out, I could put this little finger of mine in her mouth, in her models here, and touch the teeth on both sides with my little finger. And we spread this out till it's got almost, if you add that to this space right in here, it's not twice as big, but it's way bigger than just one little finger. I could put the little finger into about 2.5 times now. And bone filled in the gap. Even though there's a defect in there, bone filled in that space in there. Now you can do these things with virtually anybody. And this is what I'm saying is the suture in the future, people will more or less demand that it can be done. And some of this needs to be taught in the universities everywhere. And pediatric dentists ought to be doing orthodontics from the word go. And they do it as you need. A little bit of this, a little bit of that. There's about 20 things in pediatric dentists that need to be done before they get 12 or 14 years old. There's a lot of things need to be. And the pediatric dentist, I've been trying to get this all my life, to get pediatric dentists trained in orthodontics, and they have not done it yet. And I don't know what to do. I ain't going to be around too much longer. So I hope that this will go, that people will demand, and let them do that. And then the orthodontics can work on some of the more complicated stuff. And so here we widen this out now. Look at the size of this arch. Now this was brought out, and it brought out, this comes in as you spread it out, it tends to come in this way, see? So it brought the front part in better, widened it out, excuse me, the midline's off a little bit. Now this was before we had brackets when we were in there. We did this, and then we had to close this space up where two pieces of metal between with the two layers of cement in there, and you close that space. You lost some of the torque, so we had to over torque them and guess it where it was going to go. But luckily we finished it out, and now we're closing this from one side to the other, and then a chew bubble gum, and they close that down. You get them back in just a few days, and man, when you get them together, you've got an impression, and you make a retainer that holds it like that. That was back before we had brackets. Brackets are far better, but I still use bands on the molars back here. All right, we closed that space, pretty much closed it up. And here's this young lady's facial structure and the teeth after we got through. And this just shows we didn't really build it inside or fix it like that. We brought the teeth out here, the bone goes with the teeth, and put it where it ought to be, and tilted the molars out so that the roots, we didn't just tilt the teeth out this way, we brought them out bodily. And that gives you a lot better airway. You get that person breathing through their nose. And this is the lower arch closed up like that. So here we went from this to this. And it took some time to do it. But it is much safer, and the cost is almost nothing to do this, whereas the surgery to even try to do it over here would be tremendous surgical expense. And so I'm just trying to get people everywhere in the world figuring out you can do these things to human beings' teeth. And don't think because you're 60, 70, 80 years old, and I think I'm over 90 years old and I could move my teeth today, really, if it needed to be. And this is a possibility, and it can be done, and people can do it. If you're not trained in the orthodontics to do it, learn it some way or another. I've been to everybody I could go to learn as much as I could. I tried to get the people in this school where I went to school to teach general dentist and pediatric dentist orthodontics, and they said they're not going to do it. And so people suffer because of that. It's everybody ought to know a lot about orthodontics and also about the temporomandibular joints in here. And that can be taught in the dental schools everywhere, and these schools are building up. These things can be taught. And look at the difference it makes in a person's life to do that. And that gives you a reason for being. And everybody needs some reason to be around, stick around till you get 100 years old. I don't know, I'm not going to make that, but I don't like but about 3 years, a little more, and I will be 100. And I'm still trying to get something done in this area. So I thank you for watching, and I hope that this goes out everywhere in the world and people realize that these things can be done all a person's life. I have people write back, or they send me something back. They go take it to somebody. They say, well, you're 27 years old. You can't move your teeth. You can't put the teeth in there. This is a big lie. You can have your palate separated up into your 30s, 40s, and you can keep separating. You can keep enlarging it even though the sutures don't come apart. So this is what we have ended up with. Now this person put their tongue on the bottom. This didn't have to change much, but the top was quite different. And here's the young lady. The pictures as we finished is too dark here, but here's the way it ended up. So I'm just trying to get across what can be done at any time on anybody, any race, any color. People, bone structure can be moved and the teeth can be moved almost anywhere you want to. And we've come up with a system of doing that, and I call it straight wise. We go straight to the problem. And if the problem is a breathing problem, get that corrected, because that's the way the tongue moves the teeth into place. Thank you for watching, and I'm going to sign up now, and I hope you'll watch our channel. Thank you.